Hi there, I'm Kaylee, licensed counselor and certified career counselor at the Lookout Point, and you may see some little ears because my cat is in my lap too today. Hopefully she doesn't meow during the video or whatever, but it's okay if she does. Today I want to talk about how to talk with doctors about some of your needs. One of my favorite books on this is the book How Doctors Think, and it speaks to kind of that like mindset that doctors will have and how they evaluate what's going on for you, and then how they make the decision process of what they're going to recommend or prescribe for you. Now, I am not a doctor, so I'm going to speak more on the counseling side and how I communicate with doctors about my thoughts or concerns about a client so that I can coordinate care and get them the best help that they need. But you can also do this for yourself. And so tune in today if you're needing to have a conversation with a doctor, or if you are just kind of wondering what it's like to get those needs met effectively, tune in. The first thing that I want to share is that when you are talking with a doctor, they want to know about data or symptoms. And so what this means is that as you think about the things that are going on in your life, think in terms of numbers, intensity, things increasing or decreasing. So for example, if I go to my doctor and I say, hey, I'm not sleeping well, that does not give a whole lot of data. What does that even mean for you? Does not sleeping well mean you're not getting 8 hours? Or are you normally a 5-hour sleeper and you're only getting 2? So when you talk to a doctor about something like sleep, you'll say something along the lines of, normally I would get X amount of sleep, and in the last 2 weeks I've been getting, this lesser amount, or I've started taking naps because I need the extra energy. That is a way to kind of explain to a doctor where there's been a change. Also, as you begin to speak to this, talk about things that may have triggered or caused those change in symptoms. Like that sleep, for example, you might say, ever since I changed my diet, my sleep has improved or decreased by getting only 2 fewer hours of sleep a night, and I feel less rested. Or ever since I got in that car accident, I have been waking up 5 to 7 times a night. Each of those pieces of information is helpful for a doctor because then they can go and chart that, but then also as they talk through what the best options are for you, if they prescribe a medicine, not when, but if they prescribe a medicine, they can then go back and see if it's effective by saying, okay, you said 5 to 7 times. How many times are you waking up now? 2 to 3? Okay, there's been an improvement. We still want to shift or adjust some things, but we know that it's working, right? So the other thing that you're going to talk with a doctor about is your expectations or needs in that appointment. So if you're going into that appointment wanting information on things like medication or treatment options, tell the doctor that. Don't just go in and say, I'm really struggling with these things and I don't know what to do. The doctor is going to be much more effective in helping you if you can walk into that room and say, I don't know a whole lot of information about what medications are out there to help me with my anxiety, and I'd just like some information. I don't want to necessarily get on something, but we can have that conversation. Or if you go in and say, I've tried, these handful of things and I just don't feel like any of them are working. I'd like to talk about what my medication options are. That would be another way to begin that conversation. Now, in talking about medicine, and I know that everybody kind of has different feelings about this, one of the things that I talk with my clients about is I have 2 scales that I kind of play in my mind for how to decide if medicine is the right fit for you. The first scale is intensity, and both of these are somewhat subjective, so please understand it is going to be based on kind of how you view these numbers. But for me, I have a scale of 1 to 10 on intensity, And if a person's intensity of symptoms is a 7 or higher, and for me, 7 or higher means it is starting to keep you from doing the things you need to do. A 10 would be you can't do any of the things, like maybe you can't go to work. A 7 or higher might be you're starting to show some absences from work or something like that. A 6 or lower tends to be like, okay, let's try a couple of things and see if they will help. Now, the second scale that I use is how long those symptoms are lasting with interventions. So obviously, if you've been bearing through anxiety for months now, but you haven't changed anything like exercising or journaling or things like that, well, that makes sense that the symptoms would remain. However, after you start counseling and begin practicing skills, if those symptoms remain at the same level, let's say that they were at a 5 and they just continue to be at a 5, my number is usually around 6 weeks, that if 6 weeks after trying some new things, you don't see any changes, that's again another conversation to have. Now keep in mind, I'm always monitoring that scale of intensity. The last thing that I would encourage you to talk with a doctor about is any questions you may have. And that may sound really silly because, of course, we want to ask questions. But a lot of us go into those offices and kind of forget all the things that we were going to ask. And so this is more of a tip to do beforehand. Write those questions down, whether it's on your phone or on a piece of paper that you know you will have with you. Write down the questions that you have for that doctor about what to expect, side effects, what kinds of things to pay attention to, what the medicine is going to help if you're talking about medicine, for example. Make sure that you are, throughout all of that, continuing to have that conversation openly so that you can have those expectations clearly set for yourself and feel like you were able to make an informed decision. So I hope that this video has been helpful. I know that it can be really hard talking with professionals in a variety of fields, but talking with doctors does not have to be hard. And obviously, as I said, I'm not a doctor, and so there may be some out there that have even more tips. If you are a doctor and you have some tips, please leave comments below. I would love to hear those as well, to see if there's anything that I may have missed in all of that. Until next time, I hope that you are well, and please take care. Bye.